Dear learners, now we are going to learn about initiative at the national level for health and well-being. In this module, you will learn about how the initiatives has been taken at the national level. So, on the list of content, let us learners outcome. Myself, Dr. Netranand Sahu from Delhi School of Economics, University of Delhi, Department of Geography. Let us start the lecture. The learners outcome, the learners will know introduction and objectives like introduction, objective, overview of national health policy, structure of India's healthcare systems, village level healthcare infrastructure, block level healthcare infrastructure, district and state level healthcare institutions, then national level apex healthcare institutions, public private partnership in healthcare, and also learners will know about ministries and other institutions and role of Ministry of Health and Family Welfare, then role of Ministry of Ayush and Traditional Medicine, role of Ministry of Women and Child Development, and role of Ministry of Chemicals and Fertilizers, role of Health and Wellness Centers. So, let us the government initiative and policies like Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana and National Health Mission, Poshan Abhiyan, and then we have also like introduction of the Indra Dhanush immunization drive and Pradhan Mantri Suraksha Abhiyan. So, we have like communicable disease control programs, then regional disparity in health access and digital health initiatives and technology integrations, then case studies, and also finally in the role of international organizations, and we will also have some final outcomes and future strategy and policy recommendations, conclusion and reference. So, let us start. Learners outcomes like this study explores the key aspects of India's healthcare systems and national initiative aimed at improving health and well-being. It covers critical areas like such as the healthcare structure, major national health programs, digital health integrations, regional disparities and public-private partnership, and it is also offering a comprehensive view of India's healthcare landscape. By completing this study, learners will able to know understand India's healthcare structures, explore the three-tier healthcare systems which delivers healthcare service from the village level facility to the national institutional level. Examine key health initiatives like understand major programs such as Ayushman Bharat, the National Health Mission and also Mission Indradhanush and Poshan Abhiyan which aim to improve healthcare access and quality. So, recognize the role of digital health integrations like assess the impact of digital health technology such as the National Digital Health Mission and telemedicine especially in rural healthcare settings. Then analyze like regional disparities in healthcare like learn about the difference of healthcare access between states like Kerala, Tamil Nadu, Bihar and Odisha, and also explore the public private partnership and understand how government and private sector collaborations such as Tata Trusts and the national dialysis programs have enhanced the healthcare service in India. Like evaluate the role of international organizations like how the international organizations working in India like WHO or Bill Gates and Melinda Gates foundations contribute to the India's healthcare programs, develop insights into future healthcare strategy like gain insights into strengthening primary healthcare, then leveraging technology and ensuring financial sustainability for universal health coverage at the India level. So, basically this is going to have how many type of programs we have at the national levels. So, in this we have let us start like India's healthcare policies aim to provide equitable access to healthcare for all citizens, aligning with global health goals such as United Nations Sustainable Development Goal programs which promotes health and well-being. National initiatives focus on building and improving health infrastructure, reducing disease burdens and also achieving universal health coverage, ensuring that no citizen is denied essential healthcare service due to financial constraints. So, we have main fixed objectives like the primary objectives of these are like national initiative includes achieving national health goals like focus on reducing maternal and infant mortality, at the India level, and controlling the spread of disease, like promoting preventive health care systems and achieving universal health care systems. So then second is like implementing key national initiatives like programs such as Ayushman Bharat, National Health Mission and Mission Indradhanush are crucial for expanding healthcare access, especially undeserved areas like for example remote tribal areas. Addressing then health disparities, like emphasize reducing healthcare inequalities, especially in the state like Bihar, Odisha, Uttar Pradesh, which lag behind like Kerala and Tamil Nadu in the healthcare outcomes. Okay. So then we have a overview of national health policy, like national policy 2017 and National Health Policy 2017 is designed to achieve universal health coverage by offering comprehensive healthcare service to all citizens, and it emphasizes the preventive, promotive and curative care with a particular focus on universal rural and tribal populations. And within that, like key components like health equity, the policy seeks to reduce healthcare inequalities by prioritizing undeserved populations in rural and or tribal areas. Then universal health coverage like aims to provide all citizens with access to like essential healthcare services supported by the programs such as Ayushman Bharat. Then maternal and child healthcare, enhance maternal and child health outcomes through programs like Mission Indradhanush and Jan Suraksha Yojana, which promote immunization and safe deliveries like for in the tribal and remote areas. So then long term goal, like the policy's long term goals include reducing maternal and infant mortality rates, controlling disease and building a robust healthcare systems at the national level. So that main purpose is to ensure that all citizens have access to high quality medical care systems. Then structure of the India's healthcare systems, like India's healthcare systems is organized into 3 tiers, which progressively deliver healthcare service from rural to urban to cover the basic primary healthcare systems at that 3 tertiary level. Like for example, sub-centers we have for example found in villages and rural areas. Then what are service they are providing? Like provide basic health services such as immunization, maternal and child care, family planning and health educations. So then it needs staffs then managed by like auxiliary nurse, midwives and Anganwadi workers, male health workers. Then also it covers like population coverage such as each sub-centers service approximately 5,000 people to cover in the plain area and 3,000 in the hilly or tribal or remote areas. So these primary health centers like for example are established at the block level in rural areas. So and also like provide outpatient care, basic diagnosis, maternal and child health care and minor surgeries at the primary health center level. Then this leads to like led by primary medical officers with nurses, paramedicines providing additional supports. Then those coverage like each primary health care service around 30,000 people in rural areas and 20,000 people in the hill or tribal areas. So then we have also community health centers, like community health centers are situated at the district level and offer more specialized services. So these services include like emergency surgeries, inpatient care and specialized maternal health care, and here staffed by specialists in surgery, pediatrics, obstetrics and then also we have anesthesia. Then we have population coverage like at the community health center services approximately 1,20,000 people and act as a referral center for primary health centers. So this flow of healthcare service, like healthcare services begin at the village level with sub centers and primary health centers, then which provide basic cares. Then there are more complex cases are referred to like at the community health centers from the primary health centers. From that means from the block level to district level, and then advanced medical needs for patients are referred to the tertiary care institutions like at the district hospital and national facilities such as at different states we have AIIMS. Then village level healthcare infrastructures like sub centers, service provided like for example sub centers are essential in providing basic healthcare services such as immunization and antenatal and postnatal care and family planning and health education. Basically after pregnancy the women are taking care of these health centers, and these centers play a vital role in disease prevention and health promotions in rural areas. Okay. In like basically in the staffs are there at the tertiary level, and also different centers like are managed by the auxiliary nurse midwives and also male healthcare workers, and provide essential healthcare service at the community level. So, what are their rules? Like these are the first point of contact for healthcare in rural areas, helping to ensure timely medical interventions and support for the local populations. Then we have like primary PHCs or primary healthcare centers, and this service provides like primary healthcare service offers outpatient services, maternal and child health care, and basic diagnosis service and minor surgeries. They also manage national health programs such as immunization and disease control efforts. Okay. So, then we have at the like from block level to district level, we have like manage all these systems, whether it is community health centers or primary health centers, it is managed by supporting staffs, and these supporting staffs at this center highest level to three tertiary systems, all are managed by different types of like paramedical staffs, and they are also giving access to like essential health services to the rural patients. Then in the role of primary health centers play a critical role in delivering health care at the rural level, helping to reduce the burden in higher level hospitals, like providing early diagnosis, treatment and referral for complex cases. If there is complex cases, they will be referred to the district level. So, importance in maternal and child health both at sub-center and primary health centers are pivotal in improving maternal and child health outcomes. So, that means they help like reduce maternal and infant mortality by providing self-delivery services, early detection of high-risk pregnancies, and also immunization programs, like when the delivery happens, then what type of immunization will be provided. They are the basic contact point. These facilities are crucial in ensuring that rural population receive appropriate health care, particularly for maternal and child health. Then what are the block level healthcare infrastructure that means we have like healthcare infrastructure at community health centers. For example, service provided like in the community health centers are the step off from primary health centers and offer specialized service such as emergency surgeries and maternal care and inpatient services and outpatient consultations. They also handle complex medical cases referred by the primary health centers. And here also like at the community health centers, like staffs are specialized professionals including surgeons, pediatricians, and then obstetricians, and then anesthesia and also nursing staffs. Then their role is like community health centers service are referral centers from the primary health centers, and specialized care has been taken care of at the district level. They play a crucial role in the reducing the load on district hospitals by providing secondary health care services at the block level. So, these specialized services like community health centers provided several critical services like surgical service. For surgical service, that means they are handling minor surgeries and emergency operations, particularly for obstetric and also pediatric cases. Okay. Then maternal care like provide emergency obstetric care, manage high risk pregnancies and offer neonatal care. Okay. And sometimes like emergency cases, for example, offer fast aid trauma management and also emergency care before referring several cases to district hospitals. And the role of these community health centers act as a bridge between primary health center and tertiary health care systems. They are essential in delivering secondary health services to the rural populations, especially like in the village level and also undeserved areas then access to the advanced medical care is limited, the area where it is limited. So, each community health centers service approximately have around more than 1 lakh or 1,20,000 populations they are covering, making them critical for health care in rural regions. Then we have also district and state level healthcare institutions like district hospitals, for example, and then we services, and then these provided like a district hospital offers both inpatient and outpatient cares, and they have like they provided more advanced diagnostic and treatment options including emergency services, specialized surgeries and trauma cares, and also they have like they have good infrastructure. Typically district hospitals have 100 to 500 beds and are equipped with operating theatres, intensive care ICU, and also blood banks, and they also have diagnostic facilities such as X-rays, ultrasounds and laboratory services. So, district hospital provide secondary and tertiary care, serving as referral for like centers for community health care and also primary health care, and also handling more complex medical cases. They play a vital role in managing public health emergencies and also offering specialized service that are not available at the community health centers, like for example at the block level. So, then state medical colleges service, like these institutions provide super specialty services including cardiology, neurology and oncology, and state medical colleges are referral centers for district hospitals and manage the most complex cases. For example, their role in training and research, like state medical colleges also train doctors, nurses and paramedics persons, providing clinical exposure in teaching, like also teaching in hospitals, and they are also at the forefront of medical research and innovations, contributing to the advancement of healthcare in India. So, basically the role of medical colleges and medical like college play a crucial role in the healthcare ecosystems by training medical professionals, offering hands-on training to future doctors and healthcare workers. Basically, these colleges makes the next generation healthcare professionals. Then medical research, like conducting research to address emerging health issues and improve clinical practices. For example, in public health contributions, like engaging in state health programs and clinical trials to develop new treatment protocols and improve public health outcomes. So, at the national level, Apex healthcare institutions, like Apex Institutes in India has several national level institutions that provide super specialty healthcare systems and lead medical research in the country. For example, we have All India Medical Institutions. So, this All India Institute of Medical Science, like AIIMS, is renowned for providing tertiary care in the super specialty areas such as organ transplant, advanced surgeries and critical care. It also offers education and training for health professionals and is leading in the medical research of the country. Then what are their roles? Like AIIMS contributes significantly to public health studies like medical innovations and also the development of new treatment protocols, and for example postgraduate institute of medical education and research. Then we have also like PGIMER specializes in advanced medical research and super specialty clinical services such as cardiac surgery, nephrology and also oncology. So, in the role of these healthcare systems, like it plays a critical very key role in medical innovations, like focusing the critical health care areas and public health research. National level research and tertiary care services, for example institutions like AIIMS and PGIMER and JIPMER, like Jawaharlal Institute of Postgraduate Medical Research and sciences, focus on cutting edge research and offer tertiary care services, especially for complex medical cases. Like any patient who is complex, very complex in conditions, they are instrumental in advancing healthcare through their research on new treatments and also public health protocols. Availability of new research through research, whatever new advancement they also added in that. Then public private partnership in healthcare, like Tata Trust in cancer care, for example. Partnership of, like you can say, Tata Trust have partnered with various state governments to enhance cancer care infrastructure, particularly in rural and undeserved or remote or tribal areas. So, what are its impacts? The partnership has established comprehensive cancer care centers, improving early detection and also how to access these treatments, especially in the regions of limited healthcare facilities available. So, they have also national dialysis programs. For example, a collaboration between public hospitals and private dialysis centers ensure affordable dialysis services for kidney patients. And then what are its impacts? Like this program has significantly increased access to dialysis care in both rural and urban areas, providing life-saving life-saving treatment to many into otherwise might have access to very difficult to access it. So, then we have like first diagnostic centers like private PPT, like private partnership projects. For example, In this, like government has partnered with multiple private healthcare companies to support health awareness campaigns and diagnostic services and preventive healthcare initiatives. So, what are these impacts? These partnerships have enhanced healthcare delivery by leveraging private sector innovations in public health campaigns and digital health solutions. Then we have case studies, for example, Tata Trust Cancer Care Model in Assam. What are the challenges? Like Assam faced a high burden of cancer cases but had limited care facilities. Like for example, what are solutions? Tata Trust set up a new cancer treatment centers and mobile cancer screening units, significantly improving early detection and treatment access. So, what are these outcomes? Like these efforts have led to reduced late stage cancer cases in rural areas and improving the patient outcomes and cancer survival rates. Like those who are early detected, they have been cured through medicines. So, ministries and other institutions like role of Ministry of Health and Family Welfare, like a role of and division of like the Ministry of Health and Family Welfare plays a key role in overseeing public health services and implementing national health programs like Department of Health and Family Welfare. And what are these functions? This department is responsible for public health services, policies, formulations and the implementation of health programs focused on prevention, promotion and also rehabilitations. So, what are the focus area? Like it focuses on providing health services across different levels from primary to tertiary care, ensuring access to essential health care for all citizens. Like the Department of Health Research, for example, like this department promotes medical research and innovation in healthcare, and also like it works closely with institutions like the Indian Council of Medical Research to support research based policy making. Like what are the major programs like Ayushman Bharat, for example, the largest government funded health insurance program in the world. Like Ayushman Bharat provides financial protections and access to the secondary and tertiary care for over 500 million beneficiaries. The National Health Mission, for example, comprising the National Rural Health Mission and National Urban Health Mission. This program focuses on improving healthcare access in both rural and urban areas with an emphasis on maternal, child health and non-communicable disease. So, if we will see like mission like Indradhanush, for example, aimed at increasing the immunization coverage for children and pregnant women, this program seeks to eliminate preventive disease through comprehensive vaccination campaigns. Like those in the remote areas are not provided the vaccinations, this is very helpful. Role of Ministry of Ayush and Traditional Medicines, the key role in the Ministry of Ayush is responsible for promoting traditional healthcare systems such as Ayurveda, Yoga, Unani, Siddha and Homeopathic. So, these traditional systems are deeply rooted in India's cultural heritage and are integrated into country's healthcare systems. Like we have Charak and Sushruta, they have Ayurveda, the main propaganda. You can see in the ancient India they have used this, and through now we have a Ayush ministry. The ministry focus on integrating these traditional healthcare practices with modern medicines to provide a holistic approach to the health and wellness. And it emphasizes the importance of preventive healthcare and natural therapies, especially for chronic disease and lifestyle related disorders. So, what are its focus area? Like preventive healthcare, for example, promoting healthy life practices and disease prevention through traditional medicines. Like chronic disease management, for example, using Ayush systems to manage chronic conditions like diabetes and arthritis which require long term care. So, then we have also problem of like mental health and wellness. So, that also encouraging the use of yoga and meditation for mental well-being, stress reductions and lifestyle modifications. So, then at the National Ayush Mission, actually there are National Ayush Mission and Wellness Centers, like a National Ayush Mission. This mission aims to strengthen the Ayush educational systems, ensure quality control of Ayush medicines and also increase the availability of Ayush services in the rural areas. That means Ayush wellness centers, like these centers integrated into health and wellness centers under the Ayushman Bharat schemes, provide both traditional and modern medicines. They focus on promoting mental health and managing lifestyle disease and offering treatments based on yoga and Ayurveda. So, basically these are very not side effects. Role of Ministry of Women and Child Health Care, like integrated child development programs, for example, services like we have, then what are the integrated child development service program aims to provide the health and nutritional status of children under 6 years as well as pregnant and lactating women. Okay, those after the pregnancy, how they will have to take care of nutrition values. So what are the program offers supplementary nutritions like immunization and health checkups and preschool education for children. One of the largest outreach programs globally, ICDS, covers millions of children and women, especially in rural and disadvantaged areas. And this again like Poshan Abhiyan, for example, Poshan Abhiyan, the objective is this initiative focuses on reducing malnutrition, stunting and anemia in children, adolescents, pregnant women and lactating mothers. Like what are the focus area? The program promotes behavioral change through awareness campaigns on nutrition, linking families to health services and improving dietary practices. Like depends upon the dietary, your nutrition level will increase. And implementation of the mission works on closely with Anganwadi workers, health workers and community participation to drive behavioral change and improve nutritional outcomes. Then Janani Suraksha Yojana, for example, like Janani Suraksha Yojana seek to reduce the maternal and neonatal mortality by promoting institutional deliveries among pregnant women. So how the pregnant women Janani will be taken care of. Like initiatives, for example, this program offers financial assistance to women from low income households for delivering in in health care facilities. Okay. Then what is its impact? This impact basically has resulted in a significant increase in safe deliveries, particularly in rural and remote areas. Then rule of Ministry of Chemicals and Fertilizers, regulation of pharmaceuticals, the Ministry of Chemicals and Fertilizers through its Department of Pharmaceuticals and plays a vital role in regulating the production and also pricing and distribution of medicines across India. It ensures that essential drugs are available affordable prices, particularly for low income and vulnerable populations. So in that context, the primary goal of this ministry is to ensure that all citizens have access to affordable and high quality medicines. It works closely with the National Pharmaceutical Pricing Authority to regulate the prices of essential drugs, preventing overpricing and ensuring that medicines are accessible to all. What are the key initiatives? Like Pradhan Mantri Bharatiya Jan Sambandhi Yojana. So what are the objectives? PM BJP aims to affordable high quality generic medicines available to public, significantly reducing health care costs. Like Jan Aushadhi Kendras all over, over 7,000 stores have been established across India, providing generic drugs at lower price compared to branded equivalents. So what is its impact? This initiative has reduced healthcare costs for millions of people, particularly those from the lower income groups, and increased access to essential medicines across the country. Then at the national list of essential medicines, for example, the national list of this aims to ensure the availability of life-saving medicines at affordable prices by regulating their inclusion in the list. The medicines listed under this are subject to price control by the government, making them more accessible. For example, medicines for diabetes, cancer and all this, the list covers medicines of for communicable and also non-communicable disease as well as the emergency cares also. Okay. So what are the role of these health and wellness centers? The comprehensive primary health care health and wellness centers provide a wide range of services including disease prevention, treatment, vaccinations and family planning and basic outpatient care. These centers are a key component of the Ayushman Bharat initiative and aim to improve primary health care services across India. The non-communicable disease screening, one of the primary rule of this is the focus to early detection and management of non-communicable disease such as diabetes, hypertension and cancers, regular screening for at risk populations help in early diagnosis and better disease management. For example, if you have a early disease detection, then you can have a better medical systems, like you can provide exact medicines. Maternal and child health care services offers to comprehensive range of maternal and child health services including antenatal and postnatal care, immunization, nutrition counseling and management of malnutrition. Like malnutrition cases are more in the children, so that means they need to be more care with the also the pregnant women and after post birth, and also women should be taken care of for this. So, this is basically the rural expansion, like you can have a significantly expanded healthcare access in undeserved rural areas or maybe remote areas by integrating traditional and modern medicines. They offer affordable and accessible healthcare to populations that previously had limited access to medical services. This focus on prevention, like you can see, plays a key role in the disease prevention through community awareness programs, hygiene promotions and support for government initiatives like mission, different types of how the goals and targets has been set, like for example mission Indradhanush. These centers help promote healthy behaviors and reduce the incidence of preventive disease in rural areas. Then what are the government initiatives? Like Ayushman Bharat, for example, Pradhan Mantri Jan Arogya Yojana. So, Ayushman Bharat or Pradhan Mantri Jan Arogya Yojana is the world's largest government funded healthcare insurance programs, and its goal is to provide financial protections to India's economically vulnerable populations by offering health insurance. So, the program aims to reduce the financial burden of hospital care by offering cashless and paperless health services to eligible families. It ensures access to high quality healthcare services including secondary and tertiary care without the financial strain that often comes with the serious illness. For example, if you have serious illness, no money, then this like from low income group, so you can do this like service. So, basically this insurance provides up to 5 lakh for family per year for secondary and tertiary health care across a network of paneled hospitals. Like you have paneled hospitals, within that you can go and you can check with this insurance if you have that insurance card accessibility. So, then more than 25,000 hospitals across India participated in this program. Like for example, targeted population, for example, the program benefits over 500 million individuals from low income households, primarily focusing on the rural populations and the urban poor and also vulnerable groups such as the elderly, women and also children. And what are the scopes? Like this insurance covers over 1,350 medical conditions including major surgeries, cancer treatments, cardiovascular disease, organ transplants, diagnostics, and it provides cashless healthcare services to eligible families, ensuring they receive the necessary medical treatment without facing financial hardship. Okay. So, this is a very huge success program, slowly it is improving the healthcare systems in India. Then we have like components of National Health Mission like rural health missions, and these are like launched in 2005. The National Rural Health Mission aims to improve healthcare in rural areas by strengthening primary and secondary health services. What are the focus? Like the National Rural Health Mission focus on the maternal and child health, disease control and improving healthcare infrastructure in rural areas. Like key initiatives include enhancing institutional deliveries, providing skilled birth attendants and also reducing children or child mortality rates, you can say. Then National Urban Health Mission, like what are the, like these are introduced in the 2013. The National Urban Health Mission focus on the providing essential healthcare services to the urban populations, particularly the urban poor, slum dwellers and vulnerable groups. So, what are this focus? Like this address the urban health challenges such as the lack of healthcare infrastructure in slums and non-communicable disease and access to basic health services for the marginalized urban populations. And you can see also this like focus is to like reducing maternal and child mortality. Initiatives like Janani Suraksha Yojana and Mission Indradhanush have helped reduce maternal and infant mortality rate like through increased institutional deliveries and improved healthcare systems. So then non-communicable disease management, like the National Health Mission focus on the screening and early detection and management of non-communicable disease such as diabetes, hypertension and cancer through health and wellness centers, like we have different health and wellness centers in India. Then sanitation and hygiene, like initiative like Swachh Bharat Abhiyan, Clean India Mission, and this aims to improve the sanitation and hygiene practices and reducing disease related to poor sanitation and like unclean water. So then we have like Poshan Abhiyan, for example, like how to get the nutrition level, so that all the nutrition level of the like pregnant women and children, and also that will enhance like the anemia among children, so that will be also strengthened, like people, adolescents and pregnant women, and also we have mothers at the initial levels. The initiative promotes behavioral change in nutrition practices and seeks to improve access to nutritional services. Then what are the key components? Like supplementary nutrition, like the mission provides balanced meals through the integrated child development services program at Anganwadi centers and focusing on undeserved rural areas. And then nutrition supports include supplementary meals to the children under 6 and also pregnant women and also lactating mothers. Then health monitoring, like growth monitoring of children under 6 is conducted using technology with a special focus on anemia management. Then women and children receive like iron and folic acids supplements to address anemia concerns, and this like behavioral change communications, for example awareness campaign promote like how the excessive breastfeeding programs such as like proper weaning practices and healthy eating habits. The goal is to drive behavioral change through community engagement and nutritional education's impact. Like Poshan Abhiyan has played a crucial role in reducing malnutrition and stunning rates in India. So by encouraging healthy eating habits and ensuring regular health checkups, the mission has improved the overall health of children and women, particularly in rural and tribal or remote areas, disadvantaged areas, that has a very success. Then Mission Indradhanush, for example, immunization drive, like giving vaccinations to for all the children under the 2 years and pregnant women. The program targets vaccines, particularly different types of vaccines we have for the children, and so like preventable disease including measles, polio and tetanus, and ensures that no children or pregnant women is left without access to the life-saving vaccines. So focus on undeserved populations, like the mission specially focus on undeserved population in rural areas, tribal area and urban slums, and these are often have lower immunization coverage, and Mission Indradhanush works to ensure equitable vaccine programs throughout the country. So since its launch in 2014, Mission Indradhanush has immunized over 37 million children, and this program has significantly improved vaccinations coverage in high priority districts with historically low immunization rates. So the expanded coverage, the intensified Mission Indradhanush initiative targets districts with persistently low vaccination rates, working to ensure that all eligible children and pregnant women receive timely vaccines. So this expanded focus has helped close the immunization gap in many rural areas and remote areas. So then we have Pradhan Mantri Surakshit Matritva Abhiyan, for example. So this Pradhan Mantri Surakshit Matritva Abhiyan, for example, ensures the safe pregnancy care for all women by providing free comprehensive antenatal checkups. The program aims to giving morbidity and reducing this, like women receives the necessary care and interventions, like what are the monthly antenatal checkups. Women receives free antenatal care on the 9th of the every month, including physical exams like basic diagnostic and health screening. These checkups help detect early signs of high risk pregnancies. So then health screening and diagnostics, like women undergoes ultrasounds, blood pressure checkups and blood and urine tests and nutritional counseling. they are also provided with supplements like iron and folic acids to prevent anemia and other nutritional deficiencies. So, then at the high risk pregnancy identifications, like high risk pregnancies are identified during these monthly checkups, and women are referred to specialized healthcare centers at further like higher from lower level to tertiary level. Okay. So, for treatment and care. Okay. So, then we have like significantly reducing maternal and neonatal mortality risks. So, this has a substantial increase in the detection of high risk pregnancies and has improved access to essential antenatal care in rural and remote areas, promoting healthier pregnancy outcomes and reducing maternal mortality rate. Okay. Then communicable disease like for example, National AIDS Control Program. So, since 1992 we have National AIDS Control Program, like we have already these things we have also discussed in other modules. So, this like AIDS, tuberculosis, all these care systems are there. So, here free and managing drugs for tuberculosis are available. Then leprosy also, you can see also this little bit of this detail has already there in the previous modules. So, for example, AIDS and HIV, so we have widespread awareness campaigns like testing centers and also different types of disease like how to prevent these AIDS. So, that campaign is there from the rural to urban to also from tertiary to like all the three systems of health in India. So, this is basically giving awareness of creating how to reduce the AIDS among particularly in the adolescents. Okay. Then also like this like communicable disease across India, like particularly in rural and tribal areas where access to healthcare is limited, they provide life-saving treatment and support for millions of people, like helping reduce the spread of infectious disease and improving public health outcomes. For example, regional disparities in health access, like health access between the states, like India's healthcare systems varies significantly across different states, with some regions performing better than others. Like these disparities in healthcare access, quality and outcomes, and particularly not noticeable between states like Kerala and Tamil Nadu and Maharashtra, which has a stronger healthcare infrastructure, and states like Bihar, Uttar Pradesh and Odisha, where healthcare access is more limited. Like for example, Kerala has a very well established healthcare infrastructure offering like very good health coverage to all the parts of the state. The state has like a low infant mortality rate and maternal mortality rate, and due to strong focus on the primary health care and immunization. And but in case of Bihar, for example, struggles with inadequate healthcare facilities and low health expenditure. The state experiences high MMR and IMR, especially in the rural areas where access to healthcare services is limited. So, other states like Tamil Nadu and Maharashtra have improved healthcare systems, offering better access to healthcare services for both rural and urban areas. But if we will take example of like from Uttar Pradesh and Madhya Pradesh, similar challenges as Bihar, with healthcare systems strained by shortage in resources and medical personnel and regional differences in the infrastructure and outcomes. So, if you talk about the infrastructure, like for example, state like Kerala and Tamil Nadu and Maharashtra have better healthcare infrastructures and more doctors and stronger health care systems compared to the northern and eastern states. But for example, like Bihar, Uttar Pradesh, we have and Odisha, we have very less healthcare systems and staffs also. So, then infrastructure is also very less. States with stronger healthcare systems like Kerala show better health outcomes, including lower rates of preventable disease and high life expectancy. In contrast to weaker healthcare systems in the states like Bihar lead to higher mortality rates. Okay. So, like digital health initiatives and technological integrations of health systems, like we have for example how this digitization helps the healthcare systems. For example, in the COVID time we have vaccination programs. The digitalization helps a better way to how to like create awareness through digitization like mobile systems, and we have other communications of electronic health records for both patients and healthcare systems. So like even a bottom up click you can book for the vaccinations during the COVID time. So then also you can get a certificate for this COVID that you have already taken this vaccines. So that type of digitalization for a huge country like India very essential, and this like creates not only awareness and also it process smoothly with that, like telemedicine for example. You can have a telephone call to a doctor and you can get some prescriptions and you can use that. So that trusted systems slowly it is also creating like awareness among the literate people, so that they are using also telemedicine systems, which is also digitalized platform that there it allows like doctors to diagnose and treat patients remotely, reducing need to travel to their places. So like there are such technology availability. So also in the medical systems in India also these systems like teleconsultations, already 3 million teleconsultancy has already done in various parts of the India also. Like in case studies for example, you can have like Tamil Nadu's success in integrated digital health solutions, like pioneering in digital health. Tamil Nadu has the leading in integrating the improving healthcare outcomes. The state's healthcare department's initiative aimed at improving the efficiency and quality in digital health systems, and also this is one of the best example also, like Tamil Nadu government's hospitals have adopted digital health systems, and these integrations has reduced the duplications of tests and improved treatment efficiency and allowed healthcare providers to make more informed decisions. Basically no repetition of the same test in different types if we are digitize all these systems. Like one patient is coming, so what type of medicines or what type of tests he has done, all this system is digitized, so everything can be accessible to the doctor. So doctor can see it easily and they can also take a decisions. So like decision taking systems and time for these tests are also multiple tests and repetition of tests reduce, and that also impact the burden of the cost to the patients. So then we have like accessibility, like telemedicine and digital health records have expanded healthcare access to the like tribal areas, for example remote areas. So we have some problems also in the to cover this also in other parts of the country, like particularly remote areas. Then another case study, like we have Kerala. Kerala's health system is built on a strong foundation of like primary health care, which ensures universal access to the essential health services for all citizens. And this is basically the life expectancy of Kerala is very high, and Kerala has a very successful provided the comprehensive healthcare services focusing on maternal and child health care, immunization, all these systems, and also at the primary health systems and promotion and also prevention. These outcomes at the community level also very good at the Kerala, we can say. So like they have their own systems, like how the state government is have developed this from primary to tertiary level. So Kerala is a leading example of effective public health management in India, like the state constantly outperforms in the health outcomes. So very low mortality rate and having more literate persons, so they are also accepting these healthcare systems and awareness among the people. So like disease control, Kerala has a robust system of disease control. So that means they have a proactive detection of non-communicable disease and also improving all over public health outcomes. Okay. Then another like regional health success stories, for example the like malaria immunization in Odisha, for example, like intervention of Odisha launched the like Durgami malaria initiatives, like through that they are comprehensively focusing like how to diagnose and treatment so that the people can benefit it. So like these states focused on efforts to make its national model for malaria control, and like in dengue control in Tamil Nadu for example also, like this type of awareness campaign among different states are also better, like how these initiatives has been taken at the national level. So like for example surveillance systems has played a crucial role in Tamil Nadu preventing dengue outbreaks. Okay. So then we have also tailored healthcare programs, like these regional centers for example are very like improved level. So we can have a very strong like at the what type of initiatives at the national level they are taking. Basically these states are very good. Dear learners, in this module you learn about like how the initiative has been taken at India level, like from primary health center, community health center to district to state level. So then we have like at the national level different types of programs, different types of medicine systems, and also like case studies, through case studies like Kerala, Tamil Nadu, Maharashtra, Uttar Pradesh, Bihar, Odisha, we have focused on this, like how these different types of medicine systems and all these systems has been initiated and challenge has been overcome. So, I hope learners has learned a lot of things from this module, and for your reference, like I have given here references, books and also some websites and research articles. I hope learners will go through that for their clear understanding of the subject. Thank you.